So today I want to talk about a topic. I don't know if there are too many people talking about it, but I decided to do so, especially in order to help some other people. Maybe you get an idea, maybe it just helps you listening in case you're in the same position as I am. So, first of all, I have to tell you that I've been a cancer patient for over 3 years. I was diagnosed with a rather rare kind of cancer. It's called Leiomayosarcoma. And I'm stage 4. It means, stage 4 means it has spread to other organs. At the moment I have 3 tumors. One in my left lung, it's a nodule. And I've got 2 new tumors growing on the it's like attached to my liver, but it's on the it's underneath my liver. It's on the lower side of the liver, but it's attached to the liver as far as I understood. So the topic I want to talk about is how medical staff, how hospital staff can cause you anxiety. Not only when you have cancer, but this stream is about cancer because I'm suffering from it. But I'm sure that also other chronic diseases, you may have the same problem. But it's actually, when you think about it, it's actually quite sad that medical staff, doctors, nurses, whatever, hospitals, can cause you anxiety. It's a paradox because those people and those institutions like hospitals, they are there to help you. But sometimes, they make everything even worse despite the treatment. So I've been a cancer patient, I live in Jerusalem, and I've been a cancer patient here at Shaare Zedek Medical Center for the entire time since I was diagnosed. I've had 2 surgeries, 2 stomach surgeries, 3 different kinds of chemotherapy, and I had 3 months ago I had radiation on my lung nodule. And so far I haven't had any reason to complain, really. Everything went fine. The medical staff is nice. Of course, you always have some exceptions, that's very human, but there's no reason to complain about. And my treatments were, it was good. Everything went fine until now. All this more than 3 years, everything was fine. I didn't really have a reason to complain. And treatments were more or less successful. I'm still alive, as you can see. But it started with my last CT scan. Every 2 or 3 months I have to have a CT scan to see if the cancer has spread to other organs or if the existing tumors have grown or shrunken or remain the same size. And exactly a month ago I had my last CT scan. And usually when I have a CT scan I wait for basically 5 days, maximum 5 days, until I get a result. The result I get the CT department sends me a SMS early in the morning, usually on the 5th day, that I can, I can talk to my oncologist or I can have a printout at the oncology. The result is ready. So this is what they sent me by SMS. They let me know. And this time, it just didn't come. I did not get a result for 3 weeks. For 3 weeks. No reason was given to me. Someone could have said, I don't know. We are having difficulties, whatever kind of difficulties. But there was nothing. They haven't given me any reason for not providing the CT result. And there won't be a reason. I will never know what the reason is. They don't tell you. They just don't tell you. For reasons of being sued or I'm not really too interested in the reason. I just wanted to have the result because I was suffering, and I still am, from tremendous stomach pain. And this could be from my previous surgery last August, or it could mean that I have a new tumor. So to me it can mean anything, I never know. If I'm in pain, whatever kind of pain, there could be something popping up again. And this means I have to have treatment right away, either radiation, chemotherapy, or surgery, because my kind of cancer is extremely aggressive and my tumors have always grown very fast. So it is a matter of time, it is a matter of weeks, or weeks, to react to tumors. But this time it just didn't come. It came after 3 weeks. After 3 weeks I got my CT result. In the meantime I had to complain to the hospital director of Shaare Zedek. I also sent a copy of my complaint to the Ministry of Health. Of course you don't hear anything, right? You don't hear anything. And my goal was not that everybody's reacting now to me. This is not my goal. My goal was, and is, that I'm getting the result. If anyone reacts, like the hospital director, I don't want anyone to phone me or whatever, or even to send me an email. I don't want this. I'm not after this. I just wanted the result. And suddenly I got it after my complaint. I don't know if it has anything to do with my complaint, but I got the result. And this was the main goal, and fine, that's it. So it actually showed that my lung nodule does still exist after radiation. So we decided with my oncologist so that we wait until the next CT to see if radiation is still going to have any impact on this, because with radiation it doesn't show immediately. There is no solution, there's no result immediately. You have to wait for a couple of weeks, a couple of months even, until you know if it helped or it didn't. Fine, but the CT result also showed, as I mentioned in the beginning of the stream, that I have 2 new tumors. One is the size of, I have to say this in centimeters now, in inches, I don't know. One is the size of 2.5 centimeters, and the other one, the second one, is the size of, I think, 3.9 centimeters, which is already, it sounds small, but for this amount of time, it has already reached a certain size. And as I said, with me, it's always, in another month, the size could be double the size from now. It could be now it's 3.9. In another month or 2, it could be already 7 centimeters or something like this. Because with me, it's always that the tumors grow extremely fast. So I have to react, or the oncology department of Shaare Zedek has to react right away. When something like this is popping up, we have to react. And so far it was always, and worked out, that I had a new tumor, and my oncologist said, go to the reception desk and book your chemotherapy appointments. This time it was different. When I saw my oncologist last, it was 2 weeks ago, I think. So the result, the CT result, still hadn't arrived then. So what he did was looking at the pictures, and he told me that there is nothing, and he gave me a referral for the next CT in 3 months, and this was it. And I was extremely worried. I couldn't believe it, Of course you can say, not everybody is an expert of looking at CT pictures. Of course not. But when you are not an expert, when you are not a radiologist, when you only think that there is nothing, you know? So don't say it and don't put it into writing. So don't say it. So say, you know, I don't see anything on the CT pictures, but you know, I'm not an expert, so we have to wait until the official result. And not just, oh, there is nothing, you know, here's your referral, come back in 3 months, bye. So I was very disappointed from my oncologist. I've never seen him behaving in this way before. It didn't cause me anxiety, it just caused me kind of, yeah, disappointment and maybe a little anger, but more disappointment. Because it gives you the feeling, you know, that you're not being taken seriously despite a stomach pain. So at least he gave me a referral to see my surgeon, the surgeon operating on me last August when I had my heavy-duty stomach surgery. So I saw the surgeon last week, and in the meantime the CT result had also arrived. And I talked to my surgeon and he phoned my oncologist, and so we're going to have a meeting this week to talk about how to treat the tumors. I do not want another surgery, and I didn't intend to do so. And my surgeon also told me that I'm not having surgery. We can do this by having new chemotherapy or radiation. Although another oncologist who was in charge of my radiation did send me a message that he would not recommend radiation on these 2 new tumors, but chemotherapy. And this is all I wanted when I read the CT result. I wanted to go on chemotherapy. Usually, I had one exception, but usually chemotherapy works very well for me. So this is what I intended to do. But you know, I didn't hear anything from the hospital. I didn't hear anything from my oncologist, so I booked a new appointment with him, and it was very important to me to talk to my surgeon before, and he's supporting me, which is very nice and very professional, I have to say. And he also treats my stomach pain. I got painkillers, very strong painkillers, and he couldn't really find a reason for this. It could be that it's still, you know, because of my last surgery, I had a mesh put inside into my stomach because my stomach muscle was cut on the right side. So they put in a mesh, 2 meshes actually. And it could be that the pain is coming from there. But in the meantime, he gave me painkillers that helped very well, I have to say. And we will see this week when we have the meeting. So I'm definitely going onto chemotherapy. And sometimes, and this is very sad to say because until now everything has worked out so well for me with the medical staff in Shaare Zedek, but I have to say that, you know, being in this situation and having to wait, first of all, they're causing a cancer patient to wait for 3 weeks. For 3 weeks. You know, it's a kind of, I don't know, it's kind of disgraceful. Of course, they don't care. You know, they have, hospital is a business and they don't care. So they treat patients and, you know, patient in, out. Some die, some survive, you know. But it's a business, and for many doctors, it's also a career. And they don't know how it is to have cancer, for instance, even though they are oncologists, but they don't suffer from cancer. And I'm not someone, overreacting and being stricken by anxiety and climbing up the walls. I'm not like this. But, because I had the stomach pain, I wanted to know what's going on. And always when I'm in pain, it has turned out in the past, every time I was in pain, it had turned out that I was right and there was a new tumor. Every single time. my oncologist told me, usually cancer patients don't feel new tumors. But I don't know why, but with me it has always been different. I was in tremendous pain. I had some pushing somewhere, and I knew something is up. So I went to have a CT, and bingo, I was right. I don't know why it happens to me, but with me it's always, I feel it in a way. I may be wrong in the future, but so far I have been always right, and I had quite a few tumors. So what can I tell you? It's in a way it's pretty sad that a patient like me, for instance, and also other patients, you have to deal with cancer, with all these problems and bureaucracy, with the healthcare and everything you want. And I have to say that I'm a very optimistic person. I'm not sitting at home, being depressed, and 24 hours I'm thinking about cancer. I do not. I think, and this is my opinion, that you always have to have a goal in life. A goal in life is very important. It doesn't matter if you are sick, if you are homeless, if you are in any other kind of distress. You always have to have a goal in life. And as a cancer patient like me, it is not my goal to survive cancer. Of course, I do want to do it. And I just want to get out of this situation and not going to the hospital anymore and just being like everybody else. This is, in a way, it is my goal. But this is not the goal I'm talking about. You should always have a different goal in life. Let's say you want, you want to take pictures of certain buildings. You want to read a special book, any kind of book. Or you want to go for a long walk, or you want to travel to, to the next village because you want to hike there, to go on a hike. This is the goals I'm talking about. And this is always what you should have besides fighting cancer. You always need another goal, and you always need to keep up your ordinary life, to get up in the morning and, to do something, but not sit and, be depressed and think about cancer. I never do this. I try to be normal, although I'm weak from different kinds of treatments and I'm in pain, but, I'm not sitting here in pain and crying and, and whining around, pulling out my little violin. I'm not doing this. I try to do my best. I go outside and I even learn, I started learning a new language now. I started learning Arabic, which I find very interesting. You always have to do something in life. And don't be stuck in your, in your cancer mindset. I'm just the opposite. But what I wanted to say is that you as a cancer patient have to deal with so many things in your life. As I said, bureaucracy with the healthcare and everything, and going for all kinds of treatments and nasty treatments and, kind of torture treatments with all these, instruments at the hospital that seem endless. And then you have to deal with, you have to not fight, but you have to push medical staff in order to get treatment or to advance, this whole thing. Medical staff should be there and they should get the idea by themselves because they studied it and this is their profession, to kind of help the patient and get the idea. But today it has just turned into, into a business and into reputation and into career and into what. And the main important thing seems to be that the staff goes home at 3 or 4 o'clock in the afternoon, and until then leave me alone. So you have to deal with the with the illness itself, and then you have to deal with, with certain kinds of people and certain kinds of medical staff. It's unbelievable. There is just sometimes there's not enough time to deal with the illness itself, because you're running after all kinds of, now I have to run after medical staff to do something. And you always have to push people, not always. So until now, I was actually very lucky. I never had this problem. Everything worked out fine, as I said. But suddenly you are in a position where you have to, push hospitals, and I wish I would not have this experience, but I do. I don't know, maybe it's natural, or maybe it's human. I have to turn the light here because the sun is slowly going down. And yeah, this is what you have to deal with as a cancer patient, and it's not easy. It's just not there's not much time to sit at home and relax and rest and I don't know, and just sleep or take a break and deal with the illness or let the body heal. But you have to run around, and then this anxiety comes. Anxiety comes because you have the tumors. You have new tumors, and they're attached to the liver. My 2 new tumors are attached to the liver, on the lower part of the liver, on the bottom part, and but it could grow any second, so to speak, into the liver. And you want treatment, because you want to do something. You're very anxious to do something. And then things just don't move. And this fact can cause you, and did cause me until last week. It caused me lots of anxiety. Of course, I try to get my mind off and do something else. But on the other hand, something is growing in your body, and people, certain medical staff, they just concentrate on, I finish work at 3 or 4 o'clock in the afternoon and leave me alone and don't bother me because I want to look on Instagram or something, or do something else, or come back in 3 months, you know what I mean? Yeah, I hope you're not in the same position. I hope everything is fine for you, and that you never have to deal with certain difficulties, as I call them, and I hope that everything is being solved and worked out this week, and that this will not happen again. I really hope so. Worst case scenario is I have to change hospital. I have to change the hospital, which I don't really want to do. If there was no choice, if there was no other choice, nothing works out, I would change the hospital. But I really hope that everything is going to work out this week, that we will find a solution very fast, and so that I do not have to change the hospital. But I've heard from people, from other cancer patients in the United States, that they even had to change hospitals. It's actually quite, I don't know, it happens quite often as far as I heard. I know some people who have left Shaare Zedek and went to the competitor Hadassah in Kerem. I do know certain people, but because I have had so far quite good experiences with Shaare Zedek, so I would like to stay. But if there's no other choice, what can you do? You can't just sit and wait and do nothing. So you have to make decisions. But as I said, I hope everything is going to work out fine this week, and we will see. But I think it is important for everybody to know that there can be problems or difficulties like that. And many people who are, healthy people, when I was still healthy, I never thought about something like this. I didn't even know there is such a pain. When you are healthy, you don't think about such things. But suddenly your life changes from one day to the other, and suddenly you have to deal with people you don't really want to deal with, and with treatments you don't really want to deal with, you know, and then you start missing your old life. And there is, if I really have one goal, I would like to go back to my normal life and not being at the hospital all the time, only to go for CT scans every 3 months and being told, you know, everything is fine, and getting the result after 5 days, but being told everything is fine and see you in another 3 months, and that's it. You know, this would be great. But for the time being, unfortunately, I depend on the hospital, and I have to face my disease. But as I said, I'm very optimistic. Even with pain, even with new tumors, I'm not surprised they popped up, because I have always something popping up. So I'm not surprised, but I just wanted to know, you know, there's always this feeling, at least with me talking about myself, I have to know. And I think that any hospital should, you know, provide the patient with, in my case, with very fast treatment. And especially, you know, as a cancer patient, you can't wait forever. This is not what a hospital is for. And this is not, if I were a doctor, this is not why I would want to become a doctor and study medicine. So this is all I have to say. If you have any questions, please let me know. And as I said, I hope you don't have to deal with it. I hope everything is fine with you. And the best is stay healthy. Of course, you know, sometimes you don't have a choice. It just pops up, you know. I didn't want cancer. I didn't ask for it. It just came without me even knowing or realizing it at first. But, you know, enjoy your life as long as you're healthy. That's very important. And, yeah, never give up. And don't be depressed. Always be positive. So thank you very much for listening, and I will keep you up to date about what's happening